Hi, welcome to the muscular system. This is a big one, and typically we would start with the kind of microscopic anatomy of muscles and the arrangement of muscles and things of that nature. Maybe we would talk about muscle movement, and so there's a whole kind of chapter of material that we could talk about before actually giving a bunch of names to the muscles. And so I'm jumping ahead just a little bit, and so hopefully this works. I did want to point out, however, that here we're in the systems view, and when we go to muscular system, it's organized based on muscles of expression, muscles of mastication, your chewing muscles, laryngeal muscles, lateral neck flexion, head rotation, head and neck extension, head flexion, mandible depression, inhalation, exhalation, shoulder movements, elbow, wrist and hand, upper back, lower back, abdomen, hip, knee, ankle and foot. So it's kind of regional and based on regional and actions. I wanted to show that we also have a whole section on muscle actions, and this is pretty fun because it gives little animations, and you can, while it's animating, you can say that's the temporalis muscle, and we can fade it if we want. We can see here's our masseter muscle. We can fade that one, and we have they've divided the masseter into both a superficial and a deep, which is fine. Sometimes we just learn it as one muscle, the masseter muscle, and sometimes we break it into parts, which technically it is. There's a superficial portion and a deep portion of the masseter muscle. Now, we might as well start with these muscles to give a few terms: origin and insertion. So looking at the temporalis muscle again, its origin is the stationary position, the non-moving position, and typically it's going to be proximal, but not always. So this origin isn't one single place here, is it? It's coming from the frontal and the parietal bones, and you say, well, is it originating here, 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 here? No, not really. If you were to peel it off, its attachment point is really just the edges kind of here. It's not attached firmly all through here, because this is a moving part. So the origin is, how are you going to describe that? There's kind of an arc on the lateral side of the head here, extending from the superior margin of the orbit anteriorly, and then across and down, and it, onto the temporal bone, superior to the mastoid process. That would be one way of talking about the origin. Let me hide, I don't know, can we hide enough things here that we can see the insertion point? Now the insertion point, let me even move the zygomatic and temporal bones a little bit. The insertion, we can see here is our mandible, and here's our coronoid process of the mandible. And the action is here at the temporomandibular joint. Now, it might be a little bit tough to tell from this animation, but the temporalis muscle is not involved with opening the mouth. Okay, the muscle action we can read here is mandibular elevation, or closing the mouth. You're elevating the mandible, you're raising it up. So here, as the mouth's opening, this muscle is simply relaxing. Same thing with the masseter. The masseter and temporalis muscles are synergistic to each other. They work together. So these are synergists, not antagonists. And well, you say, well, what about the opening of the mouth? What's doing that? Well, we're actually not seeing those muscles in this view. This view is focused solely on elevation. So as these muscles contract, they elevate, they close the mouth. So these are a set of strong muscles. Now in humans, they're relatively weak, to be honest, compared to a bunch of other mammals. A lot of times you can feel a ridge on a dog's skull, right? You can just feel it, and you can kind of feel a great big temporalis muscle in this fossa, this temporal fossa here. You can feel they have a big muscle. Humans, not so much. You can feel your temporalis muscle as you elevate, as you close your mouth tightly. You can feel your masseter muscle gets tight. You can feel your temporalis muscle. And some people who chew gum a lot or chew tobacco a lot, you can kind of see their temporalis muscle bulging out as they do that. Anyhow, so things about muscles: one, just know the location. Just be able to point and say, that's the temporalis muscle. This is the masseter muscle. Two, know what it does. You know, closes the jaw, elevates the mandible. And these two are synergistic. And then the third level is, what's the origin, what's the insertion? And as the action is performed, the insertion is going to be drawn towards the origin, right? Because a muscle can only pull, a muscle cannot push. You need a separate muscle that's pulling in the opposite direction. So the muscle's being stretched here while it's relaxed, but then as it gets shorter, that's when the muscle's actually doing the work. Okay, so that is the, oh, I forgot I can draw. So here's our origin, and here is our insertion, the coronoid process of the mandible. And for the masseter, and I'm going to do kind of both of them at once here. For the masseter, the origin is the inferior surface, kind of inferior lateral surface of the zygomatic arch, which is the zygomatic and temporal bones together. But the zygomatic arch, and then the insertion point is just kind of the angle of the mandible, the angle and a bit of the ramus of the mandible. Okay, so that's an example of how we're going to do this. And how do I get back to these views? So that was mandibular elevation. If we wondered, well, how do we open the jaw? Here are muscles for depression. And this is good to show that we're actually not learning most of the muscles of the body. I'm going to focus on larger muscles and more superficial muscles. So of these that we see here, what's large and superficial? This, the platysma. And platy is referring to flat, and you can kind of tell where your platysma is. It's very superficial, it's right in the skin, and when you grimace, that's when you can kind of define your platysma muscle. The origin you can see here, it's not really originating at the clavicle, it kind of goes over the clavicle. So we don't see the origin here because it's just connective tissue around chest muscles that it's originating from. And then the insertion point, we can see, okay, we can see that, well, it's, you know, this whole inferior surface of the mandible is where the insertion is. Now, how do I know? I said usually the insertion is distal and the origin's proximal, and here it seems the other way around. Well, sometimes it's the other way around. The insertion is the part that's, you know, got the movement towards the origin, and occasionally we'll come occasionally we will have muscles where this is a little more confusing, but you know, the jaw is moving, you're not lifting your, you know, you're not using this muscle to lift your chest up a little bit. Now that's, you can kind of tell this isn't a really big strong muscle. It's kind of thin and weak, and frankly you cannot, you're opening your jaw is not a super strong thing. Now there are some other muscles involved, the digastric muscle, the stiohyloid muscle, which there it is, to the hyoid bone, and the styloid process. That's kind of confusing, cool little muscle. Not going to be talking about it. And the pterygoids though, the lateral pterygoid, there's a lateral pterygoid and two parts to the lateral pterygoid, and then there's also going to be a medial pterygoid muscle, which is going to be more for grinding. Now the action of these, that's pretty confusing as to how this would open the jaw, right? It seems like at a really bad angle for opening the jaw. So, moving on, because I don't have a good explanation for how its action is working. So, moving on. Protraction and retraction. Not concerned so much for the individual muscles, but let's just see what the action is. So, you're clear. To protract is to move anteriorly in this plane. Okay, you can protract your shoulders as well, and the opposite motion is retraction, to pull back. So so there are going to be muscles for protraction and muscles for retraction. Flexion and extension are opposites. So here we see some muscles involved in head flexion, and a separate set of muscles will be for the extension. So here we're seeing both sternocleidomastoid muscles being used together. We'll see this is not the only action of the sternocleidomastoid muscles. Yes, they flex the head, which how do I know that's flexion? Because the joint angle, right? This joint angle is getting smaller, right? It's going, it was up here and now it's down here. So as the angle gets smaller, that's flexion, and extension would be that angle getting larger. Okay. There are other muscles, not surprising, and they're deeper muscles, and we're not going to discuss them. This one's kind of fun, the scalene, the anterior scalene muscles. I just think it's kind of a cool shape, but that's flexion. Extension. Now it's not going to be surprised that the muscles of extension, you're extending, and by the way, this, if you think of, that's about neutral position. So flexion is that way, extension is back up to this position, and to go beyond this is going to be hyperextension. You're going to hyperextend. This is one of the joints where it's fairly easy to hyperextend, right? So that's hyperextension. Hyperextension. So once again, flexion, which you can use your sternocleidomastoid muscles for, and then extend and hyperextend. And if we look at what muscles are involved, there are some big muscles that are going to be involved in a lot of different movements. This trapezius muscle, it gets involved in all kinds of movements, and that's not too surprising when we look at, you know, the size of this muscle and all the different places where it's originating. Okay, it's originating from that occipital spine, down the nuchal ligament, and then the spinous processes of all the thoracic vertebrae. That's a big origin. And the insertion, you can see it's coming up and grabbing onto the crest here of the scapula, and there's the spine. That's like, why? That's not the crest. The spine of the scapula, all the way to the acromion, and then the lateral part of the clavicle. Okay, so the trapezius muscle, we think of it as involved in rowing. It's got fibers running many directions, and it's pulling on the scapula, and it can pull on the head. So yes, it can pull the head and be involved in extension, along with the Splenius Capitis and the Semispinalis Capitis. And the, okay, so Splenius Capitis is a big one there. Let's just mention Splenius Capitis and Semispinalis Capitis. And they are going to be involved in multiple movements. And since they're involved in multiple movements, like I said before, learn the location. Say, okay, here's my Splenius Capitis, and one major movement. So if you think extension, great. That is a major motion for Splenius Capitis. You think, well, you know, why do I need this muscle for extension? Your head, your head would just flop forward, which it does if you listen to my lectures for too long, you know, like that. So your head's kind of front heavy. Your Splenius Capitis muscles help hold your head up all day long, and they get tired, right? Your neck gets all stiff and sore and everything, and it's not, you can kind of feel, you know, that it's a number of muscles that are getting sore there. Okay, so there's our trapezius, our Splenius Capitis, and the Semispinalis Capitis, and they're all just right along that ridge of the back of the occipital bone there. Okay, and you can just feel the insertion points. Now we have a bunch of other muscles here involved: the longissimus thoracis, the iliocostalis lumborum, that are also involved just in doing extension of the neck. How? Because they come clear up and insert onto vertebrae of the neck. So even this one, iliocostalis lumborum, clear down in the lumbar region, clear down to the lumbar. Okay, and yet that, I mean, as you extend your neck, you're pulling your rib cage, you're kind of extending your whole back. I think I would have maybe not included this for neck and head extension, maybe just extension of the spinal column, but anyhow. Rotation, contralateral and ipsilateral are terms I'm not going to talk about. Shoulder flexion. So which is flexion and which is extension? And remember, well, here's kind of the joint. So as it got bigger, that was extension. As it gets smaller, that's flexion. So here's the flexion. But we have muscles that are involved. Like I said, a lot of times a muscle has kind of a main motion, and then it's involved in other motions as well, because like this pectoralis major muscle, it has fibers coming from many directions, and it can kind of do a lot of different actions on the humerus. So, and you wouldn't think of the biceps as working on the shoulder joint. You think of the biceps as working on the elbow joint primarily, right? Because the insertion point is down here on the radius, right? The radial tuberosity there. And yet, it is involved. If we hide the deltoid muscle a bit, hopefully we can see the tendon of the biceps, and there are two heads here, so we've got two tendons. There's the short head, or brevis, and let me just pause this for a little bit, and the long head, or longus. So biceps brachii longus and biceps brachii brevis, and it's a little confusing because the muscle, brevis means short, that muscle looks longer than the longus. So we're talking about the length of the tendon really here. And both of the tendons are attached to the scapula. So they do go across the shoulder joint, right? They cross the shoulder joint. This longus crosses, remember I mentioned the intertubercular groove as a landmark on the humerus. We have the greater and lesser tubercles, and in between there's an intertubercular groove. Well, it's the tendon of the long head of the biceps that passes through there. And it originated, having trouble turning this just right, it originated on the superior margin of the glenoid fossa, or the glenoid, it's not in the fossa, but it's on the edge of it. It's the glenoid labrum. So superior glenoid labrum through the intertubercular groove. The belly of the muscle is lying on the humerus, and then the insertion is at the radial tuberosity. For both of these, they come together and form a common tendon to there. So really, this is not the motion that you're going to associate with the biceps, right? You're going to associate the flexion of the elbow joint, not the extension of the shoulder. So, boy, that was a long way of saying that yes, it's involved in shoulder extension, but it's certainly not a main muscle that you would think of for shoulder extension. What would you think of if you're trying to extend? And let's show the action again. This is a lateral view, and the anterior and middle heads of the deltoid, I think, are particularly involved. And yes, you've got some action coming from the pectoralis major. I was saying it wrong, right, and then I thought, oh, I'm saying that wrong. But for me, this is one of the actions of the deltoid. As a major muscle involved. That's what I feel tensing as I do this is my deltoid muscle, right? Now you can realize too, though, that the deltoid muscle does this. This is not the same as this. So this is extension of the shoulder joint. This is abduction. We're going out laterally from the midline of the body. That's abduction. We're taking away, abducting. ADD, adduction, is drawing in like this. And you can abduct and adduct a lot of things. I can abduct my fingers and adduct my fingers. I can, you know, jumping jacks. Jumping jacks are all about abduction and adduction, both the arms and the legs. Okay, I'm not going to go through every single motion, but just wanted to let you know that the muscle actions are animated, and I guess I'd say do stick, you know, learn first kind of major, like, you know, flexing your knee. That's kind of a major thing, right? Flex your knee. And we have our semitendinosus, biceps femoris, and semimembranosus. Our three muscles together are called the hamstrings. Okay, biceps femoris, semitendinosus, semimembranosus. Those three are the hamstring muscles, and their main motion is this. In fact, if I could fade everything else here for a second, let me pause that. Yes, the gastrocnemius has part of this, but that's not its main motion, main action. Sartorius does this, but that's not the main thing it does. The gracilis does this, but that's not the main thing it does. The main muscles for flexion of the knee are your three muscles back here together. The biceps femoris, because we have a biceps brachii, and this is biceps femoris, and then your semitendinosus and semimembranosus. And all of these share a common origin. I can't quite, there. This is your ischium, and I can't quite position this correctly to show the ischial tuberosity. The bony portion of your behind is where they're all three originating. And they come down and they insert onto the tibia, but there is a difference as to the sides, and you can feel this. Feel the back of your knee, your popliteal fossa, and you can feel the tendons on both sides. These are your hamstring tendons. Now, if you feel carefully, and I'm doing this, and you should be doing this too, feel carefully these tendons. On the medial side, you'll feel more tendons than on the lateral side. The lateral side is one tendon from the biceps femoris. So just knowing that, we can say, oh, this is a right foot. This is a right leg here, because this biceps femoris is lateral. And the semitendinosus, think of the long tendon. So it's coming down and inserting onto the proximal medial portion of the tibia here. Semimembranosus is beneath that. And so let me fade the semitendinosus a little bit. Yeah, I'll show it. So semimembranosus is right beneath it. It's a big wide muscle, and it inserts higher on the tibia than the semitendinosus. So there's the semitendinosus with a long tendon. Semimembranosus, I remember it just when I'm looking at like a cadaver or a muscle model, remember the membranosus is more medial. Membranosus more medial. The tendinosus has the longer tendon. The biceps femoris is not, I said tibia. Biceps femoris is not on the tibia, it's on the fibula, right? The lateral head. It's at the head of the fibula is where it's inserting. Biceps means two heads. So just as there were two parts to the biceps brachialis muscle and two tendons to it, it is true for the biceps femoris as well. So there is a long head and a short head. I was focusing on the long head because it originates at the ischial tuberosity. There is also this short head that just inserts onto, there's a little bit of a crest on the femur. I don't think I gave you that landmark, but you can see the back of the femur over to the head of the fibula. So that's the, it's called one muscle, but it looks kind of pretty distinct there, but it shares a common tendon here, so they broke it into two. Yeah, so what are these muscles? What are your hamstrings antagonistic to? You know, what's on the front side that does the opposite action? On the front side, you'd have your quadriceps muscles, right? So let's take a look at those. Although I started this video saying that I was going to focus on muscles of the face, head, you know, the head, neck, and trunk, and I'm already jumping to an extremity here because I got distracted with the motions, and letting you know about these. And okay, but might as well finish here with this view. This will be the last one for this view for now, with these little animations. So this is extension. So these are the muscles that are antagonistic to your hamstrings. These are your quadriceps muscles, and unlike with the hamstrings, there are no other muscles involved in this knee extension. Now, again, it's a little bit confusing just watching the animation since we only have one set of muscles and yet it magically flexes. But the extension part is the zoop, right? Because to bend the knee this way, decrease the joint angle, right? That joint angle is decreased. This was flexion. That's the job of the hamstrings. Extension is kicking, right? So that's the action of the quadriceps muscles right there. So yes, they are involved just in standing, but very much involved in running and kicking and everything like this. And the quadriceps muscles are stronger than your hamstring muscles. So if you're jumping hard and doing a forceful extension, you know, you're crouched and then you jump, and let's say you've been playing basketball and your hamstring muscles are tired and they're contracted tight, maybe they're spasming. So during at the point where, let's say you're at this point, kind of, and you're crouched, and then you very quickly extend, you jump, you can tear a hamstring. You can break a tendon of the hamstring muscles just with the force of your quadriceps muscles, because they are stronger. And I mentioned that because I was playing a basketball game once and a guy jumped and there was a loud pop and then he was on the ground screaming and crying, and that's what had happened. It was kind of exciting. Okay, quadriceps, quadriceps heads, and yet we see 1, 2, 3 muscles here. We have a rectus femoris, rectus referring to straight, so rectus femoris running straight up and down. Vastus meaning large, broad. Vastus medialis, vastus lateralis. And where's number 4? For number 4, we have to hide the boy, having word troubles, hide our rectus femoris. And we have a vastus lateralis, vastus medialis, and a vastus intermedius. Right, I can't quite highlight it because I can't take this one away, but it's the one underneath, directly underneath. There's vastus medialis, vastus lateralis from this view. You can see where that one ends and where this one ends. The vastus intermedius is in between. Now, these muscles share a common insertion. They all insert at the patella, and then there's a patellar ligament that goes to the tibial tuberosity. So the action really, they're pulling on the tibial tuberosity, but the patella is a bone, so we say they insert at the patella. Origins, we can see the greater trochanter here is involved, and here's our anterior superior iliac spine. The rectus femoris is originating at the anterior inferior iliac spine, and a little nubbin there. Okay, going back to systems view and looking at muscular systems. Let's just go through. I'm not going to try to animate motions anymore. Let's go ahead and do muscles of expression, muscles of mastication, just to name them and not do more with them than that. This is your frontalis muscle, but this is the occipitalis muscle, and you can see that there's this tendinous sheath between them, and so oftentimes it's just called one muscle, the occipitofrontalis muscle. You can sometimes it's called two muscles, an occipital muscle and a frontal muscle, but occipitofrontalis. And the epicranius, this is the epicranium, it's this large tendinous sheath there. Okay, what does this do? Well, the main action is just raising your eyebrows. Okay, and some people can crinkle their forehead better than me. I'll see if I can find it. I had a student who could really use the occipital belly of his occipitofrontalis. He could really use it well to move his whole scalp backwards. So between these two bellies of the muscle, he could really move his scalp forward and backwards, which was it was interesting enough to film. So I'll see if I can find that and show it to you. Orbicularis oculi, just a round muscle that closes the eye. And so for now, I'm going to focus on what's the muscle, what's the action. Sometimes I'll mention the origin and insertion, but in the interest of time, I'm not going to for most of this. Now, do we have more details here? Yes, we do. If we click on the little thing here, we can see the origin. Gallia aponeurotica, that's this epicranius, this tendinous sheath here is the Gallia aponeurotica. An aponeurosis is a broad tendinous sheath. This will give us our innervation, the action, the blood supply for these muscles. So for the frontalis muscle, the origin is this Gallia aponeurotica. The insertion is the skin above the eyebrows. The action to draw the scalp anteriorly, so you can move the scalp this way by pulling, by decreasing this muscle here. But mostly the action is to raise the eyebrows, right, and the skin. So the action's mostly this way. So it's a little confusing. It's like, wait, those are two opposite things, and I just said, muscles can't push and pull, and you need, well, it's just that you know, as you're squishing this, as I raise my eyebrows, it kind of just you know, pulls the scalp forward. I can't notice it on myself. Okay, enough of that one. Orbicularis oculi, closing the eye. Okay, it's very superficial, and it's originating on all these bones around the orbit here, and the orbicularis oculi does not have a muscular insertion. It's just the skin, and it's closing the eye. The nasalis muscle, you know, doing some funny depression of the cartilaginous part of the nose here, twitching your nose kind of, you know, your little bunny rabbit muscle here, along with the procerus muscle, but the nasalis muscle is good enough for us. Most of these muscles I'm going to skip. We have, you know, zygomaticus major and minor. Levator labii, there's a superioris, but the levator labii, levator to lift up, labii, you know, lips. It's raising your lips. It's involved, pretty heavily involved in smiling. Now, a lot of muscles are, including the zygomaticus muscles, and the risorius. So levator labii, zygomaticus minor and major, and the risorius are all involved in smiling, and you can see that, you know, this is going to pull, the risorius is, you know, pull the skin at the edges, and the levator is going to lift, and the zygomaticus is going to go that direction. You can just kind of see the direction that they're pulling. And the other tricky thing then is that it's very hard to isolate a single muscle's action, because when you try to do something, your body just automatically coordinates the action of a whole bunch of muscles at once. And so, you know, what is the action of just one of them? Well, if you really want to figure that out, you have to, you know, insert an electrode and make just that one muscle contract, and then try to describe the action of it working on its own. Okay, so smiling muscles: risorius, levator labii superioris, and we'll just say zygomaticus muscles. And this is the Friday night date muscle, orbicularis oris, puckers the lips. It's important if you're trying to drink through a straw, and it's a, you know, all these are muscles of facial expression as well. Skipping that one. This is not so important in humans. Auricularis superior, to, you know, action is to raise the ears. Some people can wiggle their ears pretty well. Most people cannot. So, you know, this auricularis anterior is for, you know, kind of pulling the ears up and forward. But we just don't have very good ear control. We have these little wimpy ears compared to most mammals. And we have a auricularis posterior that's going to draw the ear backwards. You know, basically, so you can, you know, think of a dog or a rabbit or something. It can move its ears to locate sounds better. Okay, kind of skipping. So really, let's keep it simple. The frontalis, which is part of the occipital frontalis, orbicularis oculi, orbicularis oris, nasalis, levator labii, zygomaticus, and risorius. Now, one more right there, the buccinator. And
buccinator.
Buccinator is how they say it. I always just said buccinator. But if you want to say
buccinator,
go right ahead, because that's how, I guess that's better pronunciation. Buccinator. Anyhow, this is, you know, right in the cheeks. It's cheek muscle, so it's right in there. The origin is, well, it's kind of the outer surface of your jaw, you know, on the edge of the teeth. So if you poke your tongue down to the edge of your teeth, you know, that's kind of where the buccinator is originating, back down there, and then coming forward, it's inserting into the orbicularis oris muscle into here. If you're a trumpeter or any sort of, you know, brass instrument, or if you're spending your time blowing up balloons for kids all day, then you're going to get to know your buccinator muscle quite nicely. And then the platysma, I've mentioned that before, for grimacing. All right, back to, oops, back to our systems view. Muscles of mastication, I feel like we got well enough. Laryngeal muscles, we're skipping. Lateral flexion, head rotation. Let's just mention not all these little tiny scaling, or you know, there's the middle scaling, and we have our semispinalis capitis, which we saw before for helping extend the neck. But let's just focus on sternocleidomastoid. This is a big muscle, and some people it's really nicely visible, but it's a nice one also for showing there are lots of different reasons that muscles get names they do. This one is named because of its origin and insertion. So sternocleido refers to the sternum, and cleido the clavicle. So these are the origins, and so they're down instead of up, but it's the origin because this is the part that's not moving. The insertion, mastoid process. Now it's not just the mastoid process. You can see that the insertion goes onto the nuchal line, which that when we were looking at muscles of extending the neck, I was pointing to the nuchal line. I didn't say nuchal line, and now yes, nuchal line. So there's your, you know, the spine of the occipital bone and the nuchal line. It's where the different neck muscles are inserting. Anyhow, but sternocleidomastoid, just sternum, clavicle, mastoid process. That's good enough for knowing its origins, its insertion, and the action depends if you're just using one or both. So, you know, if you're looking left, then you're this would almost be a good one to animate here, but if you pull this, if you're shortening this, the insertion moves towards the origin, right? So as it moves towards the origin, it's going to pull the head this way. It's going to turn the head, right? So the right sternocleidomastoid turns the head left. The left sternocleidomastoid turns the head right. Okay, back. Wish there was a quicker way to jump back to this. Muscles of inhalation and exhalation. Let's cover those and do abdominal muscles, lower back muscles, and then quit for this, okay? Take a deep breath in, take a deep breath out. So breathing in is inhalation. These are some muscles of inhalation. The sternocleidomastoid, oddly enough. Wait a minute. Well, yes, the serratus anterior. The main ones that, let's talk about the main muscles for inhaling. Not the diaphragm, or yes, the diaphragm. Is it for inhaling or exhaling? It's for inhaling. And the action, this is one where knowing the origin and insertion helps a little bit. You see the origin is all the way around, okay, and against the spine there. That's the origin, and you can see that it's dome shaped. Okay, so it's going like this, and it's inserting into this central tendon, so this whole white area. And yes, there are some holes because we need to let our aorta through and our esophagus through, but this is the central tendon of the diaphragm. And if you're pulling the insertion towards the origin, you're going to be pulling it down. You're pulling the dome down, and that might be a good one to watch. The see if there's animation of inhalation. But you pull that dome down. You're doing things to make your chest cavity bigger. So your diaphragm goes down, and you're lifting your ribs up like bucket handles. Okay, so how do you do that? Well, the serratus anterior get involved, but nah, I'm going to skip those. Let's talk about the external intercostal muscles. So you have muscles that go in between your ribs. They're intercostal muscles, and there are both external and internal intercostals. The externals, they pull up, so their origin is on the upper rib, the insertion is the rib beneath, and they pull up and out. So external intercostals for inhaling, internal intercostals are going the opposite direction. The origin and insertion are switched, and so they're pulling the ribs down and in. Most of the time when you breathe out, when you exhale, you don't use muscles. You just relax muscles. Okay, you have to use muscles to inhale, but you can just relax those muscles for exhaling. Now you can forcefully exhale, and so let's look at muscles of exhaling. And when you when you breathe out forcefully, you're going to use your abdominal muscles, because that helps. Compressing your abdomen helps compress your chest cavity. And here are those internal intercostal muscles. So for each, this is not one continuous band of muscle. It's in between each rib. So, and yes, this is when you eat ribs, these are part of it. The external and internal intercostals. So the origin is the superior border of the rib, and it inserts it into the inferior border of the rib above it. Anyhow, so when you forcefully exhale, you're mainly using your abdominal muscles and your internal intercostals. Another thing to keep in mind, yes, we forcefully exhale, but we also sometimes take a deep breath, hold that breath, and then use our exhalation muscles to push for a bowel movement, to push to get a baby out. And So we're for breathing out, we're compressing the abdominal cavity to help compress the chest cavity. For pushing out, we inflate the chest cavity and then close it off, and so we use the chest cavity to increase pressure on the abdominal cavity as part of pushing. Okay, and yes, there's some serratus posterior muscles involved in this as well, but mostly I want you to think external intercostals and diaphragm for inhaling, internal intercostals and abdominal muscles for exhaling. Now, I didn't give the names of the abdominal muscles because this isn't their main job, right? That's not the main job of the abdominal muscles. So let's go ahead and look at them from that angle of, here are muscles of the abdomen. When we see the muscles of the abdomen, we've got this big area that doesn't have bone. And we've got all these intestines and other organs behind. So we have this big open area that's protected and held together with muscles. And there's a central tendon called the linea alba, white line, running from the xiphoid process to the symphysis pubis. And this is a point of insertion for like the external oblique muscles. And the external oblique, the insertion is from the pubis to the linea alba to the xiphoid process, and to some lower ribs. The origin, it's originating at the at the pelvis here. Your you know what? That's not really the origin, is it? That's an insertion point. The iliac crest is an insertion for this muscle. The origin is here, 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 here. The direction of the fibers, you can see, it's, well, maybe I should draw the arrows the other way, because when you do the action, you're trying to pull the insertion points towards the origin. And it's a little bit confusing with these abdominal muscles because the origin can move towards the insertion can move towards the origin. So it's a little confusing with these. But anyhow, external obliques. And that's the most superficial, and you probably already know the external obliques. If we hide the external oblique, then we can see an internal oblique. And the main thing I want you to realize here is that the direction of the fibers. Okay, so with the external oblique, the fibers are going in this direction, and the internal obliques, the fibers are going 90 degrees to that. Okay, you see that? Let me hide this and show it. Muscle fibers going this way. Oops. Muscle fibers going the opposite. Okay, let me show it again. At least keep it on that side. So external obliques, the rectus abdominis going straight is the other one that we can see now that we've uncovered. We took away the external obliques. We can see the rectus abdominis, and these are the six-pack muscles that people get obsessed about, just because it has a little different bellies to it, multiple sections to it. And we still have one more. So basically, what I'm trying to say, we have this big area that doesn't have bones. We have external obliques running this way. We have internal obliques running this way, right? So external obliques are like a V. Internal obliques are like an A. The rectus abdominis is straight up and down. Then the transverse abdominis is the deepest, and it's 90 degrees to the rectus abdominis. Okay? That's all I'm saying is we've wrapped this package up 4 different ways. So there's our rectus abdominis. If we hide that, now we can see the transverse abdominis. So transverse abdominis is deepest. The rectus abdominis and internal obliques are next, and then most superficial is the external oblique. And you can break down the actions separately, but they're all working together to stabilize the abdomen, to compress the abdomen. And yes, you can isolate them a bit, and you can use your obliques to do crunches, and you can try to develop your six-pack muscles with special exercises, but they're all working synergistically to just kind of hold your abdomen in place. Okay, we're going to get to the gluteus later. Obturator, we don't have pelvic floor muscles in this view. I think we're going to go back, and maybe we're done. Well, we have the upper and lower back, but this video is getting too long already. And here we have everything together, all the muscles. The back muscles, a lot of what's on the back is moving the arms, right? Here's the latissimus dorsi, occupying most of the back. It's moving the arms. Here's the trapezius. It's moving the shoulder, the head. You have to take away quite a bit to get to the muscles that are involved in actually acting on the back. So and there are quite a few so you can just keep hiding and digging down deeper and see how deep can we go into the back here. And we get spinalis, thoracis, and multifidus. How do they?
Multifidus.
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 Anyhow, lots of deep muscles that I'm not going to say anything about. Iliocostalis, lumborum, and so forth. So we will treat the major superficial muscles of the back, including the rhomboideus major and minor, and the trapezius, and the teres major and minor. So most of the back muscles we will treat as we discuss the shoulder and arm. Okay, so that's why we're not going to say anything more there. And lastly would be the iliococcygeus and the deep transverse perineal, just some muscles of the pelvic floor. And there are others, but how do we? You kind of have to. It's reproductive. Anyhow, deep transverse perineal, iliococcygeus, and we have pelvic floor muscles. We'll just take them as a group there. Okay, good enough for now, I think. So, hopefully that was helpful. I felt like I was jumping around a little too much, but we'll try to do better when I talk about muscles involved with movements of the arm.